Dr. Brad Ralston, and I'm a board-certified chiropractic neurologist. I've been practicing here in Indianapolis for the last 12 years, and I've really been specializing in conditions like fibromyalgia, chronic pain, migraines, vertigo and dizziness, ADD, ADHD, and autism. Well, you may be asking yourself, you know what a chiropractor is, but you may be saying, what is a chiropractic neurologist? What a chiropractic neurologist is a doctor who specializes in examining the function of the nervous system. And what people don't realize often is that most conditions are localized to certain areas of the brain. So to give you an example, actually dizziness and vertigo is localized to this area back here in the cerebellum. Pain like chronic pain can be due to problems up here in the brain. Anxiety and depression can be due to imbalances in brain function. So when we look at the left and right hemispheres, we oftentimes find that they do different things. Conditions in the left brain would be more associated with depression, scoliosis, and dyslexia, and also chronic pain. Conditions in the right brain, where the right brain is underfunctioning, would be associated with anxiety, insomnia, fibromyalgia, autoimmune conditions, ADD, ADHD. So what I do as a chiropractic neurologist is I do an examination to localize which hemisphere is underfunctioning specifically in your case. And I try to ascribe the symptoms to which neurological systems are underfunctioning or imbalanced. Once I find the imbalance, what I use is specific neurologic protocols in which we use something called brain-based therapy, which is where we use unilateral stimulation on the side opposite of the hemisphere weakness. So if you have a right hemisphere imbalance and your right hemisphere is underfunctioning, I'm not going to treat you on both sides or adjust you on both sides like you might get at a chiropractic office or a physical therapy office. I'm only going to use unilateral treatment, meaning I'm only going to use your left side. And I'm going to use adjustments to your left side. I'm going to use vibration therapy on your left side. I'm going to use visual, auditory stimulation on your left side. I'm going to use olfactory stimulation. And I tricked you, I'm going to use it on your right side because that's the only one that goes up to the same side of the brain. We're also going to use caloric stimulation, which is specifically using warm and cold air in the inner ears to stimulate the opposite side brain. All these exercises are geared towards driving the weaker hemisphere up to equally and match the side of the other hemisphere so that we essentially balance the brain. Once we balance the brain, it takes care of the negative symptoms that the patient is having. Now that sounds really easy, right? Sounds like if I balance the brain, I fix everything. Well, that's not always the case. I've been in practice and had wonderful success using these protocols that were taught to me, but sometimes I never really got the patient better, or they waxed and waned. They got better and then they got worse. And there was always something missing. Well, over the past couple of years, instead of just looking at these problems as neurologic or approaching them from a musculoskeletal standpoint, what I've started doing is incorporating very specific metabolic protocols. So let me show you how that works. What makes us different now is that we now manage patients metabolically and neurologically. So once we get your brain in balance, we also have to make sure that your body is balanced metabolically. Because if you have a metabolic problem, this will always keep your neurology imbalanced, or your symptoms may be as a result of a metabolic problem, even though you have balanced neurology. So metabolically, what we do is we start off with our new patients by doing some initial blood work. These are common labs that you'll have at your doctor's office. Most are covered by your insurance. We start off looking at a thyroid panel. I want to see the complete thyroid panel. We do a complete metabolic panel. We look at a lipid panel. And we look at a CBC, or a complete blood count. We find that many patients have conditions in regards to the thyroid where their thyroid is underfunctioning, or in the functional range is hypothyroid. And what I mean by that is Many patients have thyroid symptoms even though their lab tests are normal. And this can be very frustrating. They go to the doctor, the labs are normal, but they still have all the classic hypothyroid symptoms. We have a tighter range that we look at that's called the functional range, and we can identify many functional thyroid conditions by using just a simple thyroid test. Complete metabolic panel, we want to see if your glucose is too high or there's anything off in regards to your metabolic function. Lipid panel, we're assessing your cholesterol, your triglycerides. And then CBC, complete blood count. We want to make sure you're not anemic. Once I take care of anything that comes back on those initial screening labs, I'll do more specific protocols to help me identify if there's something else that's driving your health condition. So, the next set of tests that I do are food sensitivity tests. These tests help me determine if you are sensitive to milk, eggs, yeast, wheat, soy, peanut, or eggs. These are the most common sensitivities that people have. These sensitivities can cause chronic pain or fatigue, frequent indigestion, bloating after eating, bowel changes, constipation, mouth ulcers, and vomiting. The reason people have such a problem with these foods is that they oftentimes have a condition that's called leaky gut syndrome. And leaky gut is where you have these foods that are irritating your GI system, and they're passing through your GI membranes into the bloodstream. They're attacked by an antigen-antibody response, and they're causing chronic flare-ups and a lot of GI problems for you. Removing sensitivities is a way that I've been able to really affect a lot of chronic conditions. Once I get people's GI systems better and get them off the foods that are chronically inflaming them, they can feel better in as little as 3 days. Also, anxiety and insomnia really respond to this as well. The next test I'll run is an adrenal stress index. Your adrenals are glands that sit on top of your kidneys and release cortisol in regards to or in response to physical, chemical, or emotional stress. So cortisol levels can cause insomnia and cause you to have blood sugar problems. So we'll want to assess your cortisol levels to make sure that these levels are in a range that's not causing you abnormal symptoms. Cortisol causes you to deposit fat around your waist. Some people exercise and are unable to lose weight. Well, cortisol may be to blame. If your cortisol is chronically too high, you won't be able to drop weight around your waist. Next, I'll look at immune panels. I'll look at your B lymphocytes and your T lymphocytes to see if you have what's called an autoimmune condition. Autoimmune conditions, again, can wreck you metabolically and keep you from neurologically healing from your condition. It's hard to get somebody better when they're autoimmune because they're chronically flared up and chronically in symptoms. And this autoimmunity can wax and wane. It can get better, it can get worse. We need to assess that. So we'll do immune panels. I'll make sure that you don't have any infections in your GI system. Many times people, after we get the immune labs back, will have an underlying GI infection, yeast, fungi, parasite, bacteria, that if you're not addressing is chronically going to keep your GI system sick. And then in specific cases of emotional or hormonal imbalances, I may use more specific panels. We use neurotransmitter testing to test serotonin, dopamine, GABA. All these functions control mood and behavior. And by utilizing testing, we can optimize neurotransmitter levels such that we can overcome a chronic anxiety condition or a chronic depression. Hormone panels in the case of either female or male hormone insufficiencies. We'll handle inflammation by looking at your homocysteine and your C-reactive protein. Hard for me to get your musculoskeletal system better if you're chronically inflamed. And then lastly, we'll look at glutathione levels. Glutathione is an antioxidant, and it's an immune system booster, and it's a cellular detoxifier. So using glutathione along with the oxygen protocols is a way that we help to get you better faster. So to end here, we look at what your goals are. You know, we want you to ask yourself, how has this condition affected your job, your relationships, your family, your finances, etc. These conditions are oftentimes conditions that are not pathological enough to cause your medical doctor to maybe treat them, but they're chronic, and they make you sick and tired every single day. What does it cost you in time, money, happiness, and sleep? Many of these conditions can affect people's ability to work, ability to rest, etc. Where do you see yourself in 3 years if you don't change something? Studies have shown that fibromyalgia does not get better on its own, that you have to have an intervention to correct the imbalances that are causing that problem. And what is it worth to you if you can improve your condition? So we are here to help you. I would be happy to consult with you on your specific condition. Please feel free to give our office a call at 848-6000, and we'll set you up for an initial evaluation.